In today's podcast, I want to talk about root causes. What I mean by that. Currently, I think I've mentioned in these podcasts, one of my hobbies, I'm an avid reader. When I'm not seeing clients, I just love to read. Pretty much all sorts of different things. I think it's a lost art in our world. Matter of fact, I remember recently I was out at a store and I had my granddaughter with me, and we had picked up a book that I said, do you want this book? And she says, yes. And so she was on the shopping cart, but she was reading the book. And she was just thumbing pages and reading a book, and an individual came up to me and says, wow, she's actually reading a book. It is so wonderful to see a child with a book in her hands. You don't see that anymore. You just see people on their phones and scrolling and stuff like that. But anyway, she just stopped and said that was really cool to see. Anyway, one of the current books that I'm reading that has brought me to today's podcast on root causes is called The Song of a Cell. And it's by a medical doctor. Fascinating book. And I'm just going to read a couple parts and then talk about it and how that relates to mental health issues, at least what my thinking is today. He says this, in the winter of 2002, I saw one of the most complicated medical cases that I had ever encountered at Massachusetts General Hospital in Boston, where I had spent 3 years as a resident. The patient, MK, that was his initials, MK, a young man of about 23, was suffering from an unremitting severe pneumonia that would not respond to antibiotics. Anyway, they doctor after doctor came in and was puzzled by this case. They couldn't figure out what was going on. And this poor young man, his body had been so devastated by chronic infections that he looked like he could have been just 12 or 13 years old. But he was, 23, I think? Yeah, 23 years old. And he said his skin was a papery, translucent quality that nearly crackled as I touched it. Anyway, he was just troubled by this. And the doctors basically gave him a diagnosis, but he didn't think that diagnosis was correct. And this book, The Song of the Cell, is just a fascinating read. In other words, every cell derives its stimulus from other cells. I mean, our bodies are literally made up of just trillions of cells, and they're all connected together. And the life of a body is in direct correlation to the life of the cell. And as he examined what was going on, the bottom line is this. The abnormalities in all the other cells and the breakdown in his immunity were just symptoms of a particular T cell dysfunction. And so he was able to diagnose where the core root problem was. So you think of this 23-year-old curled up in bed, where he looked like he was 12, 13 years old, all sorts of infections raging through his body, nearly to the point of death. And it was the collapse of the T cells that had cascaded through the entire immune system, causing the whole network to disintegrate. And as he came to find out, the young man did not have a variant of what he was previously diagnosed at, but it was like something called a Rube Goldberg machine, which is simply a metaphor for a chain reaction, meaning the T cell problem had become a B cell problem, cascading further into a total collapse in immunity. Long story short, they found the core issue, and then they were able to do a medical procedure, a bone marrow transplant, and then put healthy T cells into his system. And when those T cells took, or the bone marrow took, and the T cells started to work, then his whole system came back online. And this young man was able, his immune system came up, and his immune system was able to fight off all of these other things that were in his system that was threatening his life. And I think about, remember the naturalist Henry David Thoreau, who wrote the book Walden's Pond, which is just a fascinating read also, where he went out to live deliberately in the world. And anyway, he has a statement. He goes, "For every 1,000 hacking at the leaves of evil, there is one striking at the root." And as I relate that to the patients I've worked with through years, it's so challenging working with human beings and individuals. I have a friend I was talking with yesterday who is a doctor here in Florida, close, anyway, where I live. And he's opening up a clinic with all sorts of different treatment approaches, and we agree that, as he was saying yesterday, this thing works for this patient, but it doesn't necessarily work for this patient, and so on. And as I've worked, as we were discussing and working with our clients, every single person is completely a unique individual. And it's almost like being a Sherlock Holmes, trying to accurately diagnose to get to the root cause of what could be creating mental health issues, anxiety, depression. And it's very complicated. So we just throw out all sorts of different options: cognitive behavioral therapy, somatic therapy, body movements, getting your body engaged. EMDR therapy that I've talked about a number of times, especially as it relates to trauma and being able to identify what some of those painful memories are that need to be borne witness to. In other words, a person being able to identify really what some of the things that have always been bothering them, but they've never really been able to speak them. And so they remain what I call open loops. But it's not easy to do that. There's a part of our limbic system, our survival system, that tries to get us to dissociate and get away from even thinking about things that are painful in our past experience. And everyone's different. Some seem to be able to have the coping mechanisms to live a fairly functional and happy life. Then you just be with that and do the best you can. But if there are certain issues that keep coming up, that keep you stuck and keep you frozen, and anxiety is out of control, depression is out of control, we need to look at all sorts of things. If you're struggling with OCD, attention deficit hyperactivity disorder, if you're really struggling with those things, then it just means your brain chemistry needs some help. And there really is help available. There really are medications that can provide significant relief from a mind that has a difficult time focusing. I've watched that in so many clients that I've worked with, and it's been a process for me as a therapist, because at the beginning of my career, and again, I've been doing this a long time, 35, 40 years. I need to figure that out one of these days. Anyway, a long time, that I was kind of opposed to medications because I think they're overprescribed and overused. And I think the first line of defense is to try to figure out things without medications, to do everything you possibly can do. Are you exercising? Are you doing everything that you possibly can to take care of your body that way? There's so much research behind so many different things. exercising, regular saunas. There's significant research that helps your body stay strong and healthy, and your brain stay strong and healthy. Nutrition. So you look at all of those things. And so you try those things first. Mindfulness practice. Introduce breathing exercises, positive affirmations. You do all of those things, and then you see, well, how are you responding to those things? Is that working? Are you getting any relief from the anxiety, any relief from the depression? If you are not, then it means either your brain chemistry is just works a certain way and you need some help with that, or there can be some significant unresolved trauma. And unless trauma gets resolved, you can do these other things that I just mentioned, and they can provide a little relief and help. But you're treating the symptoms, which can be it can be helpful, but until you get to the root cause and really clean some of that stuff out, you're going to continue to struggle. So each of us have got to continually examine our lives. Going back to the Greek philosophers, right? The saying comes out that to examine ourselves, to take a serious look at our lives is the most significant thing we can do. Be honest with ourselves. How are we doing? Where are our blocks? Or at least being able to search for those things. And sometimes it's just so frustrating for me to hear how challenging it is for people to reach out and get help. A fascinating book I know I've mentioned before. If you've listened to any of my podcasts, Unspeakable Things by Brooke Neville's, she talks about some of the horrific things. This is a book that talks about finally being able to speak some of the things that happened to her in her life with sexual abuse issues and power and control issues, domination by those in power in the corporate world, how that impacted her to the point basically where she ended in a mental hospital where she had a complete breakdown. And then she finally was willing to get help. And then in reading her book, as she describes that process, as that saved her life. She finally was in front of professionals and she was willing to get help, and then helped her continue to heal, and to the point where she's written her book and she's continuing to move forward in life. And I also had a close friend reach out to me in complete confidence, saying, hey, I have a coworker, amazing individual that is melting down. Information is coming out about some past abuse, some past sexual abuse, and she's kept it hidden all these years, kept it hidden from her spouse, and it's creating all sorts of problems, and we're so concerned about her. She's not willing to reach out. She's full of shame and afraid she's going to lose her job, and all sorts of things associated with it. And it's just sad that people are struggling so much when they really can't get help. Some of these modalities that I've mentioned, finding a competent professional can really, really provide the relief and help. And I know sometimes it's a crapshoot, finding a therapist, finding a doctor, but you just got to keep trying, fight for yourself. I heard the story of a woman yesterday. She was actually telling her story in a public arena, and she was saying that if it wasn't for the fact that I got in therapy, I wouldn't be clean and sober right now, and I wouldn't have my life together. It's been an amazing experience. And anyway, so just back to the issue of root cause. It's something, and it's very complicated with individuals because life is messy. there are so many different issues, right, that we're all dealing with. But sometimes if we can identify some core root cause issues and be willing to journal about them, to write about them. So if you're not willing to get in therapy, I came across, fascinating information even this morning, that there's research that is significantly helpful that says write down all the negative things that you've experienced. Identify it, own it, write it down. And I know you might be thinking, that just focuses on the negative and stuff like that. No, it's actually bearing witness to it. You're identifying it, and the research is showing that individuals actually find relief when they're able to put that stuff on paper and get it down. Might be the beginning state of acknowledging it to yourself, and then maybe the next state, finding a helpful individual, someone you do your research on, someone you can trust, and to be able to maybe move to the next level of speaking about it and finding some support and healing and having someone bear witness to your life struggle and your story so that you don't have to carry this stuff alone. And one line that comes out to me from the book Unspeakable Things by Brooke Neville's, it says, nothing. So the fear, she says, trauma is, and I'm butchering it right now because I don't have it right in front of me, but her definition of trauma is something like this. It's like horrible things happen, and they're unspeakable things, and actually the fear of speaking them is almost equal to death. But then when she found she actually confronted that fear, actually spoke them, that the relief started to cascade after that. And then she started to get help. And she said nothing could be worse than the thoughts and the dialogue in her head, what she was doing to herself, because of our tendency to have a negativity bias where we look at all the negative things and what people will think of us and all this, that, and the other. But I, go back to this statement that I've held on to for many years. We are only as sick as our secrets. Secrets keep people sick. And all of those in the world, I know I'm squirreling a little bit now, but we know so much stuff is happening in the world. And people who are bound to secrets, they're in trouble. They're not going to be able to free themselves and find relief and truth from some really crazy things. The truth shall make you free. It's a powerful and interesting statement. So just wrapping up this podcast, think about the issue of root causes, and to be able to identify it, to look at it, to not run away from it, to go right into the middle of the storm. If you look at a hurricane, where is the most peaceful spot? It's in the eye. Instead of running from it, you go right into the middle of it. I know it's hard, I know it's challenging, and then all of a sudden you find peace. The truth shall make you free. Anyway, have an amazing week.